Well, what exactly is going in my back during an epidural? It's a beautiful day in the laborhood, so let me help you out, okay? When we place an epidural, what we are doing is we first put local anesthetic or a numbing medication right there at the skin, because you only have receptors for pain right there at the skin. Then we actually utilize what's called a TUI needle. And a TUI needle, we are going to be utilizing either air or saline as we pass through the layers of the back. So boop, 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 boop. As soon as we feel a shh, what we call loss of resistance, that means we're in the epidural space. The dura is actually what stands over on this side, and we don't want to nick it or go past it because your cerebral spinal fluid is on the other side. That is what a spinal is. It's when you actually go through. But don't worry, spinal needles are way smaller than epidural needles. Going back to what I was saying, so if the epidural needle is in the back and we've already found what we call the loss of resistance, okay, so we know that we're in the right spot, then we just thread a catheter. And in threading a catheter, there's nothing fancy about this. It's kind of like fishing line, okay? That's what actually stays inside of your back so we can continuously give you medication. And the medication, we just put it through here. And it's attached to the end of this little fishing line. That's it. So that's an epidural. Don't worry, there's nothing metal that's in your back. You can also move around inside of the bed, but don't get up. Why? Because an epidural is going to block the mu receptors, which is the pain receptors. But it also can affect motor. So that's the reason why we put in a catheter in your bladder after you've had an epidural, and you cannot walk around anymore. So don't try it, okay? Back in the day, literally 40 plus years ago, they used to have what we call walking epidurals. And that's just a fancy term for not using local anesthetic, instead just using pain reliever like fentanyl. But we don't do that anymore just because of the fact that contractions are painful. And so we want to make sure that you have a wonderful birthing experience. So happy birthday. Do you know that 80% of women vomit during their delivery, whether that's C-section or a vaginal delivery? Don't be that girl, okay? Grab a NoMo nausea band. So most of the time they're found through Thomas Scientific and also Sharn Anesthesia at a lot of different hospitals. So if you're a labor and delivery room nurse, you can always grab NoMo nausea. But what it is, you smell it. So the fastest way into your brain is through your nose. It's actually essential oil infused acupressure wristbands. All right. So go out there, and now that with that extra information about epidurals, you can inform people that it's not just pain relief for the moms, but safety for the babies is why we choose to do an epidural in your back.